What's your options if you're missing teeth? A lot of people are trying to avoid having to wear a denture. Nobody wants to wear a denture, take it out at night, put it in the denture cup, using a gooey sticky adhesive in the morning to try to keep those dentures on the gum, because there's nothing holding the denture. A denture is literally just sitting on the gum with these thick walls. So a lot of patients who already lost bone, these are not staying in. These are wobbling as they're chewing, their tongue is in the middle, and they oftentimes have to use a lot of adhesives on the inside to keep them in, and that's still not effective and it's not functional as they're chewing. What people started doing is they said, okay, maybe we could have implants to secure those dentures, because now we have those 4 implants and we have like a snap-on buttons on inside the denture. So now you don't have to use adhesive. These are secure, you can chew better, you could smile better, you're not worried about your teeth coming out in public. When you have them secured with implants and they're snapping on, there's no way they're coming out. There's an option where these implants are actually the teeth that come, they're screwed into the implants. So now they don't come out, they don't have walls like the denture has. These, I showed you these walls. Now, the inside of this looks very different from the inside of a bridge that doesn't have walls. We just see these screw channels where the implants would get screwed on. When they're screwed on, they look like that. They don't come out at night, okay? The snap-on still comes out. If you remember, I showed you this model, the snap-on still comes out. It's more secure than a denture. See, I can't even remove it, but it's more secure than a denture. But at night, you still have to remove it and put it in a denture cup. And this is a temporary bridge. After a few months, we replace it with zirconia final bridge. Some of these zirconias can come with a titanium bar, some don't. It really depends on the design and how much room we have and do we need it or not. Zirconias are also different. Some of them have better finishes than others. Some of them have layered porcelain on top. So there's a lot of types of bridges. So you have to be careful, understand and research what you're really getting. They did a survey where they asked patients about their chewing functions. So people who have like their natural teeth, let's call that 100%, and people with no teeth are going to be about 0% chewing function. Patients who had dentures, just dentures with no implants, reported that their chewing function is about 25%. To move step up, patients who had snap-on dentures, which is the dentures that snap onto the 4 implants, reported about 50 to 60% chewing function. And then patients who had fixed bridges, which is the one that doesn't come out over the implants, they reported about 80 to 90% chewing function. So this is as close as it can get to your natural teeth after losing them.